Hi guys, so it's been months since I have talked to you. I know I'm still not in Super HD or widescreen or anything, but I really don't care. That's not why I make videos. Not that I have been making videos for ages, but that's not why I would make them when I do. So I just watched this video about this guy who has Crohn's. I can't remember his name because I just saw it, but I'll put the video in the description. Oh hey, I can sit up now. And like, it was really nice listening to someone else similar age. Well, he's probably like 25, 30, I don't know. So someone else older talking about the same stuff that I've been through, like with a stoma, basically. So when I first told you guys that I'd had it, I was like pretty much just out of hospital, and I had moon face still, which is like, you get that when you have well, you don't always, but it's a side effect of steroids like prednisolone, which is something they put you on to make you better. And like basically moon face, your cheeks kind of, you know, you get a moon shaped face, so you just puff out. It's something, I think it's to do with the water retention, or I don't know really. You'd think I'd be an expert on it by now, but I'm really not. So I wasn't comfortable with my stoma and I hated it. It was the worst thing that could have happened. Like, the week before I had it, like, I was in work the weekend before, and I was doing an 8 till close, which is like an 8 till 5, and I'm a waitress, and I just was like, I felt so ill, and I felt dizzy, and I felt weak, and I felt horrible. And my boss came in, she was like, "You don't look very good, Megan." And I was like, "I don't feel great," and like, I was just sitting there just like, I can't do anything. So I had a few days off, and I just got progressively worse. Like, it went from like the symptoms of Crohn's, which is just like a really bad abdominal pain and diarrhea and sickness and not being able to eat and everything. Like, it just got worse and worse as the week went by, to the point where like I just slept for like 7 hours at a time, was up for like an hour, and then went back to sleep because I just didn't want to be awake with the pain because it was horrible and I felt dreadful. And I was meant to have an appointment with my gastroenterologist on the Friday of the week. So we phoned up the hospital and we're like, "I'm really bad right now. Can I just come down the night before so I don't have to travel early in the morning?" Because I felt worse in the morning and it got better in the evening. I don't know. So we went down the night before and they took my blood. I had this student, which I know students have to practice, but I was really feeling horrible, and he had to take my blood, and he was doing a really bad job of it, and it was like 1 in the morning, and I was like, I can't be bothered with this. And then he was like, "I don't think it's actually Crohn's, I think you've just got an infection." Sent me down for some x-rays, and it was really bad. Anyway, I'm getting off subject. So I went down and I was like, I feel horrible again. And basically in the morning, after the blood tests had been like run through, came down, and we're like, "Okay, so your inflammation levels at like, it was like 250 or something, it's meant to be below 5, I don't know, it was really bad." And they were like, "So we really have to look into doing surgery on you." And they told me this last time I saw them. And I was like, "Okay, so this is going to be in a while." And they were like, "So we're going to do it tomorrow." I was like, "Okay, tomorrow? That's really soon." So it was fine, and my nurse was talking to me about it and everything, and I was kind of being like, "Okay, this is just something that's happening, it's fine, whatever. It's rubbish, but it's fine." And yeah, so I've told my mum. She wasn't with me, it was my dad that was with me. I told my mum, and mum was like, "Well, you'll be okay, because you've had operations and stuff before." Like, I had my spinal fusion operation, and you know, yeah, so I was, you know, I was feeling not too bad about it. But it was all just really like sudden, so I didn't actually have much time to think about it. And then, you know, you've got like bowel prep, which is like it tastes so bad, like, oh, it's really bad. You have these sachets, and they're meant to be like vanilla flavor, and it's just not even remotely like anything. It tastes dreadful, and you have to drink like 3 jugs of it, and it makes you go to the toilet basically, so that you're ready for surgery, because obviously you wouldn't want anything. Yeah, you can probably imagine the rest. So it was in the morning, and I hadn't slept very well, obviously, because, you know, stuff on my mind, and I felt horrible. And I remember getting, like, the doctor came down, he was like, okay, so hi, I'm this guy, and I'll be one of the people there. And then he left, and then I just, like, I was in this ward with, like, 4 or 5 other people, and I just started to freak out, like, I had like a full-on panic attack, kind of, like, I was screaming, I was just like, oh my god, what is happening to me? How am I so ill all of a sudden? I was fine last week, and now I'm going to have surgery in like the next few hours, and I'm gonna have a stoma. Oh my god, oh my god, oh my god, freaking out. And it was a really, really low moment for me in my life. Like, I know I'm only 18, but I felt so horrible, and I just felt pathetic, and just, I wasn't even thinking at that point. I was just freaking out. I was like, oh my god. I didn't have time to process anything, and it all just came out at once, and it wasn't nice. Anyway, so that happened, and the nurse came and she calmed me down. I had a cup of tea, because obviously tea helps everything. No, I didn't have tea. Oh, well, I wanted tea. I wasn't allowed to have tea. You're not allowed for a while, but I was gonna have tea. Anyway, so yeah, that happened, and then I don't really remember fully what happened after that, whether they gave me something to calm me down, maybe, I don't know. So the next few hours I was on my way down to the operating room. Well, the anaesthetist bit first, and they were going to try and give me an epidural, because it's just, you know, it's better for, like, the pain, I guess, afterwards. But because I have spinal fusion, which I don't even know if I've explained this to you, I had scoliosis and I had spinal fusion when I was younger, so I'm fused from like here to here, like whole back, metal rods, titanium, screws, everything, the whole works, and like they put bone marrow over it so it hardens everything, so basically like you can't get to my spine. But they wanted to try, so I was in this operating room with no pre-meds or anything that I remember, and everyone like around me with like the blue and the masks and the gloves, and I was like, this is like something like out of horror film, this is horrible. And they were trying to give me an epidural and it wasn't working, and then I started to freak out more, and I was crying into this woman, like this woman's shoulder, just crying because I was terrified. And then eventually they're like, this isn't working, let's just give her like some, like, I don't know, they gave me something, and then everything was fine, and so yeah. And so I woke up with, yeah, had an operation, woke up with my stoma, and I was just kind of like, well, obviously I was on morphine, so I wasn't really aware of anything. I was in the happiest place. I was just like, not thinking about anything, like literally. My phone was on the table, turned off, because you're not meant to have them on in wards, but it was there because my dad had to go home. So my phone was there in case I needed to get in touch with him. The nurse spilt water all over my phone, killed it, and I didn't react at all. I was like, phone, it's dead, okay, bye. Like, that's just what morphine does, yeah. Obviously a few days later, when I was sitting in hospital with nothing to do, I was like, oh my god, my phone is not working anymore. This is bad. So yeah, that was what happened, and then the following week I was in hospital. I looked like shit. I didn't look great at all. I was weak. I hadn't eaten for like a long time before that because I'd started to be ill, and yeah, I don't know, I hated my stoma. Like, you get different kinds of bags, and I was on these just flat ones, like I'll explain in a bit. They were flat and they weren't sticking on me, so they kept coming off. Like, okay, so I don't know if I've explained. A stoma, it's like they basically like take out a bit of your intestine and put it on top, so it's out. So it's just this red kind of like blob that poops, basically. And yeah, so that was new, and that the bags weren't sticking, so the bags kept coming off, and obviously you can imagine that's not the neatest thing. So that kept happening in the middle of the night, which made me sad because I was like, why can't I control this? This is something that I can't do anything about. This is not good. So yeah, that was horrible. But you know, like, nurses are great. Like, I have so much respect for nurses. They're there so much. Obviously doctors can't be there all the time because they've got so many patients, and nurses are just there for you. Like, they're friendly, and they make you cups of tea, and they sit and talk to you when you've got no one else to talk to, and they help you through stuff. Like, the amount of times I had to call through nurses in the middle of the night because I was panicking or worried about stuff, and they just sat and talked to me, or they helped me change my bag when I wasn't used to it, and it was really good, and they were so encouraging, and I love nurses. They're great. Like, even just for a bit of normality, like, I remember talking to one of them about something that happened recently on, like, I don't know, it was some craze going on Facebook or something to that extent. Like, it's just a bit of normality, and yeah, I don't know, it was a really intense few weeks, and it wasn't a great few weeks. But I'm 5 months on now with my stoma, and I'm kind of accepting it a bit, I guess. Like, with my work, I call it rustle because it, you know, it rustles, like the bag, like it rustles. So I call it rustle. So like at work, like if I'm having a problem with it, I'm like, right guys, I have to go sort out rustle, and they're like, okay, cool. Like, it's just like, it's a thing now. And like with my friends, like my friend like likes the name so much, she's like, I want to call my kid Russell now. It's like, that's just, you can't explain that to your kid. If you have a kid and call her Russell, you can go, oh yeah, it's because my friend had like a stoma and she named it Russell. Like, that's just weird, but it's great. And you know, like, I had a boyfriend through it. Like, I'm not going out with him anymore, but you know, you still can have relationships with it. It's not something that stops you from being who you are. I mean, obviously it makes you feel kind of rubbish for a while, but it's just getting used to it. But like, it's alright. Like, I mean, hanging out with this guy, and like, we were watching a film, and then my stoma just was like, because you know how you get wind, and normally you can kind of like hide it, you know, it's just something that happens, but you can hide it. Not with a stoma, it just happens. It's just like fart, 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 fart. And I was just lying there just in like complete embarrassment, like, oh, what has this done? This is the worst thing. And then he was just like, it's fine. It happens. And I was like, ugh. See, people just understand. Like, none of my friends care at all, and everyone just gets it, and it seems like the worst thing. And I guess if you're younger, it probably is the worst thing, but it's manageable. And there's days where it's really shit. Like, I'll sit here just sometimes and be like, oh man, I shit in a bag. Like, why? why? But then there's days where it's like, hey, well, you know, I have this, but I'm still like, I work full time, I hang out with friends, I go to the pub still, like, it doesn't stop me living my life. Like, I did like a 60-hour week the other week. Like, last year I would not have been able to do that, and it's probably not the best thing to do, but everyone got ill. It's just something it seems like the end of the world, but it's not. And so I guess if anyone out there has a stoma or gets told that they have a stoma, like, just know that it's not the end of the world. It's horrible for a while, but you get used to it. It takes time to get used to it because it's obviously a learning curve, but I'm fine with it now. Like, I can change it. Like, you have to change your bag every few days. I can change it in like a few minutes. It used to take me like 20 minutes to do, and now I do it in like 5. Because you get used to it and you get a routine going, and it's just part of your life. And it'll probably feel weird when I don't have it, to be honest. I'll have a pretty cool scar from it, I guess, but yeah, I don't know, I just wanted to fully explain that. I don't feel like I explained, and I think I went like a bit downhill with it. Like, I got quite low about my stoma and just life in general. I was like, this is just bad. Stuff is happening and it's bad and I'm not happy anymore. So that's why I've kind of not been on here for ages, because I just went through a bit of a low bit. But like, I'm accepting it now, I guess, and I'm more, I've come to terms with myself and my stoma, and I'm like, yep, this is me, this is just part of me. I'm Megan, and I have a stoma, and I have Crohn's, and that's me, and I'm that person. And it's really nice to just actually be able to accept it and not worry about it, and be able to say to people, oh yeah, so, you know, I have a stoma, and they're like, what? And I explain to them, like, okay, cool, that's weird, that's pretty cool actually, so nice one. And it's good. So yeah, that's basically what happened. I feel like I can kind of come back to this sort of thing now. I'm really enjoying life a lot better at the moment, so yeah. I should probably go because this is a really long video, but oh yeah, I'll show you. Like, it really needs emptying, to be honest, but this is my stoma. So it's just like this bag. Of course that would happen. And yeah, this is the bag, obviously. This isn't the stoma's like that. And yeah, and I have a pretty cool scar as well. Like, it's pretty intense. And you know, I think looking at me, you wouldn't think I had that, so it's fine. Like, don't worry about it. If you have one, it's just something, and it's good. And if anyone has any questions, just leave them. I will try and comment and say if there's anyone still watching, because I mean, it has been a long time, so I'm not surprised if no one sees this. But yeah, I'm gonna go now. So, farewell, and I will speak to you soon.